All right. There we go. All right, let me go back, actually. Close your computers, please. People at home, don't close the computer because then you're gone. Just look at the screen, the full screen, the present slide, okay? Everybody's closed. I see a computer open over there. Okay. So here's what I want you to do. Get a piece of paper and a pencil or pen. I'm going to give you 30 seconds to do this problem. This is not moving. There we go. And I also don't have the timer on. Okay. Connect all 9 dots with a straight line, 4 straight lines without lifting your pen from the paper. Okay, connect all 9 dots, 4 straight lines without lifting your pen from the paper. Okay, I think some of you, about 20% of you, I see the pen going in all directions, so you're obviously frustrated. That's the point. Okay, so here's the solution. Now you go outside of the box. Bingo. What happened? Your brain said, this is a box. I have to do this in the box. This is an automatic assumption. We live with automatic assumptions. This is part of the foundation of cognitive behavioral therapy for mood disorders. But I'm going to talk about something in the context of depression. I want to talk about some of our fundamental automatic assumptions. So first, we talked earlier about learned helplessness. I said, you got to figure out what's the electric shock. What is keeping your patient in the box, right? Is it reality-based? Maybe it's a real situation. Maybe it's not. Maybe it's cognitions that are impaired. Maybe they're fortune-telling or catastrophizing or making all kinds of automatic assumptions. Maybe it's their basic schema about life. Like, I can't function in life unless someone takes care of me. Or I can't function in life because unless I have control. Or whatever it is. So that's learned helplessness. And the idea behind learned helplessness, the automatic assumption behind learned helplessness, is that the locus of control should be within us, right? How many people like to have control? If you don't raise your hand, I know you're a liar. So, we love it. But really, is the locus of control inside of you? Really? Like, just think about this. How did you get here? What was required for you to get here? You made a decision. You made a choice, right? You made a choice. The people who are on live stream, maybe they didn't have the choice to come here. Maybe they had to take care of kids or whatever. They didn't have a choice. So they have a choice of attitude. How are they going to take this? Are they going to be upset that they can't be here, or are they going to enjoy what they're doing? Hopefully they're enjoying what they're doing. But how did you get here? You drove, you flew, maybe you walked, but if you drove or you flew, you had to be in an airplane. That metal had to be mined by miners. Those mining machines had to be built with metal that had to be mined. You owe it to the person who invented the wheel millions or thousands of years ago that you were able to get here, right? The gasoline, right? The stewardess, the fabric. I'm just talking about the plane, the cab driver, the Uber, the people that wrote the software for the Uber. How did you get here? Was it you? You made a choice. But you were on a wave. You were on a wave through the environment that you're in, and you were able to ride the wave here. You made the choice. But you didn't exactly make it happen. You took one foot in front of the other. So really, is the locus of control really inside? Not really. We love it. It's a wonderful illusion, but it is not true. What's true? What's true is that we are part of a vast matrix. How do we know there's more going on? Well, the electromagnetic spectrum, we see light, we see colors, but we know that the electromagnetic spectrum extends out both directions. The physicists tell us that 95% of the universe is dark matter and dark energy, right? 95%, and they don't know anything about it. The 5% of the material universe, we don't even know anything about that. So what do we know? We know that 80% of what we teach today is false. So what do we really know, right? We are part of this great matrix. We live in the illusion of control, in the illusion of separateness, but consciousness, which you experience as local, you have your consciousness. Your consciousness is actually non-local, right? I'm affecting your brains, you're affecting my brain. We have this global field of consciousness. We have this consciousness that extends around the planet, okay? We are cut off from that. The guy who did the frontal lobotomy, I think it was Moniz, he won the Nobel Prize because he said, well, the prefrontal cortex, no function, let's just stick a knife through here, a little probe, and separate the prefrontal cortex from the rest of the brain so that people don't have severe intractable OCD. He won the Nobel Prize. Well, there's no function to the prefrontal cortex. Of course we know there is. The appendix, of course there's a function. Junk DNA, of course there's a function. Dark matter, of course there's a function. Dark energy, there is a function. So we are in what I think of as, we have a metaphysical lobotomy. We are cut off from the idea that there is something beyond our physical world that influences us. We just don't accept that because we are in our scientific mind. That's a big mistake. And that's a big mistake for patients who want to have resilience against depression. Big mistake. So part of what I'm saying is that you have to open up the consciousness of your patients. It's very hard when someone's depressed to talk to them about this. They're going to be like, I got to find another doctor, you know. But when they get better, when they're ready, you know, it's important. So, all right, so that's that. So now we all are on the same page. We all acknowledge now there's a hell of a lot going on. We don't know. And we have a metaphysical lobotomy. Okay. I now want to say that we're all brainwashed. Now, who's not brainwashed here? Okay, who is brainwashed? Yeah, we're all brainwashed, right? You see an event here and have someone from another culture see the same event, different take, right? What are your cultural biases? How is your brain being shaped by the environment that you're in? It's totally shaped. My brain is shaped by being a psychiatrist. It's warped, you know? It's totally warped. So when I realized this, that we are really brainwashed, literally, I was like, wow, it's kind of interesting because maybe I need to choose how I'm brainwashed. Maybe I need to choose what washing machine I stick my brain into. So what I did, I was raised in a Orthodox Jewish family. When I actually became a teenager, I discarded it, went off to college, had a great biology teacher, was totally convinced that there's no need to postulate the presence of a God or a creator or anything like that. It's like, you know, it's obvious. You have the Big Bang, then you have all this whole sequence of steps and everything, so forget the God thing. So I didn't say to myself, well, where did the Big Bang come from? I didn't say that. So I kind of really adopted the idea of spontaneous generation, right? Remember that germ theory? Where do germs come from? Spontaneous generation. So do you believe spontaneous generation of the universe? For me, it's hard to swallow. So what I decided to do was to look at different religious approaches, different philosophies, everything. I went to a universalist church. I went to Buddhist things. I did the meditation, the TM. I was just looking. I thought, I was raised this way. Then my professor raised me that way. Now I'm going to figure out, what do I think? So I actually spent 10 years and just trying to figure out, A, do I think God exists? And I say God, not the guy with the white beard, okay? I'm the guy with the white beard. Now I say God, whatever you want to, the great as if, the thing you can't describe. Forget what you were raised with concepts of God. Think about it as this trans-universal whatever. So I did my study, and I said, I can't prove the existence. I can't prove the non-existence of God. So the only logical position is agnosticism. So then I'm left with faith, maybe. Maybe I could be agnostic, or I could say, no, I'm atheist, and I have faith that there is no God. Or I could have faith that there is a God. Now, the data seems to indicate that having faith that there is a God is actually beneficial to me and to the people I'm around. So my logic says I should probably brainwash myself. I'm serious. It's like, okay, this is going to be a trip. I got to do this. So eventually really found myself going back to a particular type of Judaism, and knew that I had to brainwash myself, but then my logic would not take me where I wanted to go, but I couldn't cross that bridge, One day I was walking through in my office. I have these huge charts, the Roche lab charts of all I think David showed it, of all the chemical reactions in the body. So the two huge charts, I blew them up and I have them in my office. One day I'm walking by and I was like, oh, this is an accident, right? Okay, I succumbed, but it was success for me. Still, my logic didn't let up, okay? I struggle and struggle and struggle and have come to a point after years of comfort with this idea that there is some kind of force or entity or intelligence that I can actually relate to and that actually has an influence in my life. Call me psychotic. I don't care. So, what if I said to you there's a new treatment that prevents depression, decreases the incidence of depression by 29%, reduces all-cause mortality, gives you 7 extra years on your life, suicide rate reduced by 84%, reduced rate of divorce, right? Decreased substance abuse, increased happiness. Do you want it? Okay, what is it? It's religious affiliation. Okay, so for some of us, that's a hard pill to swallow. We have bad experiences. There's some bad stuff being done. Not all of these organizations are very mature. You need a mature organization that embraces cooperation, embraces life values, life-sustaining values. But here's a powerful tool. The logic to me says, maybe since I'm brainwashed anyway, I might have to brainwash myself in a way that I can take advantage of this. And I might want my patients to also, if they're inclined, take advantage of this. Maybe not. I'm not going to push it. Maybe they'd rather be in a yoga community. But it needs to be a community, a cohesive community. It needs to be affiliation. And it needs to have a spiritual, and I'm going to say metaphysical orientation. And with that, I think, over time, this is preventative. This is not when you get ill, it's a little too late. This is preventative. I actually wrote a chapter about this in the textbook of functional medicine. And the data is pretty clear. This is preventative medicine. So my goal here is to have you open your mind, because on the East Coast, where I am, the West Coast maybe, this is not PC. This is hard for me to tell people, certainly in this audience. I'm actually stepping out of the box, my zone of comfort, and talking to you about this, because I'm imagining that some people are going, oh man, wow, See, I got this little cap on my head, right? That's part of my brainwashing. Why? Because it reminds me that there's something greater than me that I don't understand. And I want to remember that all day long as much as possible. So that is the lens that helps me protect myself against leaky psyche syndrome. That's it.